guys, we are live today for the Chatting with Katie video here in beautiful Madisonville at the Children's Dental Cottage with Dr. Vo. Hi, Dr. Vo.
Hi. Hi, everybody.
So we are here doing a Chatting with Katie video on Children's Dental Health Month. February is Children's Dental Health Month, and so I thought it would be fun to come visit Dr. Vo in her office. And if you haven't seen her office, it's precious. It's like this old house in Madisonville. I mean, the river's right there. It's precious, and she supports so many organizations around the North Shore that serve people with disabilities. So that is why we're here to chat about, Children's Dental Health Month. So, Dr. Vo, tell us a little bit about your practice.
So, my practice has been around for a while. It's been here for about 20 years, but I've owned it for about 8 years now. And it's located in Madisonville, like Katie was saying. And it's a pediatric dental practice.
Yes.
And so we see children from age 0 all the way up to whenever you want to leave the practice. And we do also cater towards individuals with special needs as well, children, adults, because we want to make sure we take care of that population.
Yes, because it could be scary for kids without disabilities too, right?
Yes, absolutely.
Yes, I know my 7-year-old. He went to the dentist yesterday, and he was not excited. So even our children and adults, I've outgrown it, but I used to be very scared of the dentist too. But we want to pay extra attention to our population that has any type of special need or disability. And so you have a direct correlation with someone with a disability.
Yes, so my oldest son is diagnosed with autism, and he is considered nonverbal, and he has major difficulties sensory-wise with a lot of things, and one of them is also going to the dentist, even though it's me. So I totally get the fear of parents bringing their children, especially those who have special needs and behavior issues per se,
right?
And fears of going to the dentist. I totally get it. And one of the important things that I'd like to stress is, even though there's those fears, it's something that needs to be done, because when things are not addressed, when they do come in at a later age, whether it's 8, 9, 10, which we consider pretty late, some major issues could be arising, and we could prevent a lot of that if they're seen a lot sooner.
So do you think that by bringing your child to the dentist at a very young age regularly helps prevent some of those fears and anxieties in the kids?
Yes, absolutely. That first visit may be difficult, but as they, we like to work with, the children and the parents, and we'll do whatever we need to make it more comfortable for them. So knowing what those fears are and communicating that with the dental provider is going to help with a lot of it. So don't be scared to talk to them about what your fears are or what your children's fears are, so that they can make the experience at the dentist better. It may not 100% every time always be great. Every visit will probably be different, but it's very important to start them at a young age so that they do know that when they come in, is nothing that's going to hurt them. Right. That fear, usually once the visit is over, is totally gone, and then they're happy running around.
Yes.
And
yes, yes, that's all. Yeah. It's like all
they accomplished it.
Right, right. Yes. So I wanted to do a chatting with video. Why do I keep saying that? See, I told you I was going to love a chatting with Katie video on Children's Dental Health Month, because it's important to my family. My son Connor, who is 11, started having dental issues probably around the age of 1.5. He was not eating foods by mouth, and so he had outgrown his formula and was having to drink Pediasure. which if you are familiar with Pediasure, it's, it will give you calories and the nutrients you need, but it can be very hard on your teeth. And we were brushing his teeth, but the Pediasure and the combination of some of the medications Connor was on, it really damaged his teeth. And I wasn't aware of some of that stuff. And so we had to see a dentist in New Orleans. And so dental issues, especially amongst our population, has been very important. But I wanted to talk with Dr. Vo about some tips for parents that she could give to help explain the importance of dental health, especially in our kids and even in the kids with special needs. So if you could give our parents, some quick facts that they need to be implementing today and every day, what would that be?
So first and foremost is going to be brushing, and I think everyone should have a toothbrush, and if not, we give out free toothbrushes a lot of times, but everyone should be brushing at least twice a day, if not once a day, morning and evening, and getting in there and flossing as well. That's very important, not just for the teeth to prevent cavities in between the teeth, but also to help with any type of inflammation of the gum tissue in between there where the food is getting packed. And then secondly would be nutrition. Nutrition is a key in making sure that, whether it is a child with special needs who, is G-tube fed, or if they are eating a very non-nutritional diet, that it can cause multiple problems, whether it's tartar buildup, gingivitis, periodontitis, or cavities. So nutrition includes, what we drink. And so that is usually the biggest culprit here is sweet tea. Sweet tea is the big culprit down here with cavities. So, drinking water is the best thing for us to drink. And having all of these other fun things like juice, tea, special occasions, or, just at meals. The third thing, very important, is to see your dentist. Regular visits to the dentist is so important because to the naked eye, things may look great. Yeah. And then, you come in and then we may detect cavities that are unseen because we're able to take x-rays and we're able to use specialized instruments and just checking to make sure we're brushing properly. Sometimes you're brushing, but you may not be brushing every part of your teeth in the proper manner. So there are 5 surfaces on one tooth. So, getting all of those surfaces is difficult. So coming to the dentist, the hygienist, or the dentist can really explain to you how to brush those teeth and how to angle that toothbrush and how to use the floss. So I think those are 3 major things that really need to be addressed daily and throughout the year.
Yeah. How often would you recommend children see their dentist?
So generally it's every 6 months that they would see their dentist, and I would start them at an early age, and early as 1, or within 6 months of their first tooth erupting. Yeah. And that way, a lot of that is going to be educational visits where the parent comes and we are going to brush their teeth, show you how to brush their teeth, show you how to use the floss, show you, if they're crying, it's okay if they're crying, right? To go ahead and still brush. It's always going to be some type of struggle at some point, but it's just getting through those times and knowing that those times are okay. So hearing it from a professional and seeing it from a professional who knows what needs to be done is going to help you tenfold in your everyday life with dealing with brushing. Yes,
it will. The earlier the better.
Yes.
Because as kids get bigger and older, their bodies get bigger, and I know with my 7-year-old, sometimes he needs mama to help brush his teeth and remind him how to brush his teeth to get in, you know, all those hidden spots that's hard to reach. So definitely I agree, starting the earlier the better. So I just want to reiterate, you know, that February is Children's Dental Health Month, and I think it's a great time to show your children. You can go online, you can show them this video. There's a dentist, you know, she's giving you tips. Explain the importance of taking care of your teeth. I know my 7-year-old, he's like, well, I'm going to lose these anyways. And I'm like, well, you have more coming in. So, you know, they'll be with you for a very, very long time, and you need to take care of your teeth. Yes. So, did you have any other last-minute tips or suggestions?
The last thing, since you brought up, you know, your son saying, oh, I'm going to lose these anyway. So, those baby teeth serve such an important, many important things as far as your health and your body. First and foremost, they are very important because they serve as space so that those new teeth have a place to come into.
Right.
So if you were to, let's say, get a cavity and have to get that tooth removed, that new tooth isn't going to come in for a long time, and things start shifting around into that spot, and then you start having other issues.
Yes.
So we want to try to prevent that. And those baby teeth also help us to talk and eat and smile.
Right.
The first thing that people notice is when we smile, and so that's really key in also teaching them early on with their baby teeth. They can do a good job with their adult teeth.
Right. Yeah. Yeah. Because I know sometimes we get in that thought of, oh, well, they're going to lose it anyways. It's okay, you know, if the dentist has to pull this tooth because, you know, it's got a cavity, or, you know, it's infected or something that. But that's a very important point, that tooth needs to stay there for as long as it can, until it's supposed to come out.
Until it's supposed to come out.
Great reminder. So, guys, thank y'all for tuning in. And if you are looking for a dentist, I suggest this cute little place, you know, especially for our friends that have any type of special needs, because Dr. Vo is obviously a pro at it, you know. She lives it every day, and she loves it. Yes.
I do. I love it.
Her staff here is so sweet, so sweet. Yeah. So thank y'all for tuning in, and y'all go educate your kids on Children's Dental Health Month. Yes. Bye, guys.
Bye-bye.
All right.